Okay, I think maybe I will just begin. Welcome to the GHP Brown Bag Seminar. I think this might be the last one of the semester until people come back after the summer. So today we're very delighted to have Dr. Terence Cheng to present to us some of the work that he's leading on examining the internet health market in China. Even though he's using China as the context, what he's studying is actually very relevant for the world. I mean, especially after COVID, internet health has become a platform, a media that might be picking up a more of a mainstream market in healthcare. So Terence just joined us as a research scientist. And before that, he was associate professor in the Department of Economics at the Adelaide University. And he got his PhD from the National University of Australia, and before that he was from Singapore. So he has done extensive amount of work, especially looking at public-private healthcare market, but probably more on what we call the offline market. And so what he's presenting is in some way extending it, the private market to the online market. So he'd be very happy to take questions during his talk, and he loved to have it as more conversational and informal. So over to you, Terence.
Thanks, Winnie. Thanks for the introduction. Is my mic okay? Am I coming across okay? Okay. Thanks for the opportunity to speak to you, and thanks for taking the time to attend this session. As Winnie introduced, I've joined the Department of Global Health and Population about a year ago. In fact, a year in this month. So I joined last May, and I spent the last decade working in predominantly Australian universities and kind of looking, and with my main research area being in understanding how public and private sectors of healthcare interact. Also, since many of us are working remotely, I've never had the opportunity to kind of meet my colleagues. So I thought this also would be a good first opportunity to kind of meet everyone a bit in a virtual environment. So let me just share my slides. Are you seeing my slides? Okay, let me just turn to full screen. Is this full screen okay?
Yes.
Great. Okay. So as the title of my talk indicate, I am actually going to describe an emerging body of research that we are working on to describe the developments in China's internet health market, a market which I personally feel is rather unique and also really quite interesting. Part of this talk also, in addition to introducing this market, is in hope of starting this conversation among people here at the school and possibly beyond as well, to understand how digital markets, internet health markets, kind of vary across different countries, across different settings, possibly looking at interesting work, cross-country collaborative work that we can all do together. So I've been asked to prepare roughly about a 30-minute presentation, and there's also quite a lot of slides to cover. So what I really would be doing is giving you an overview. Possibly if there are questions related to details of the system, we can kind of take that in the Q&A. So let me just first acknowledge my colleagues that I'm working with in this big research area. We have at Harvard Chan an informal China Internet Health Working Group consisting of researchers over in our department, Peking universities, University of North Carolina, Indiana University, where we meet regularly to kind of talk about these developments and also working together. And a lot of these ideas that I'm going to share with you also benefited from conversations we had within the broader kind of membership in the Harvard China Health Partnership. So it's kind of not my thoughts alone. Well, although every era, all areas would, I'm fully responsible for. I'm also very glad that Winnie is actually moderating this session. So if there's any difficult questions, we can kind of deflect it to Winnie, if I may. Okay, first let me start with giving kind of just a big picture and bring us to 20,000 feet and just look at some numbers in terms of broad landscape. Over the last decade or so, China's internet health market is really rapidly expanding, and it's growing at a very, very fast rate. And it's, I suppose, when we look at the experience of developed countries mainly, and in fact, developing countries, as a result of COVID, we do see many countries adopting digital technologies. But something that is also quite interesting from this figure is that a lot of this growth happens before COVID itself. So if we take ourselves back to 2013, the investment, so this shows the total value of new investments in China's internet market, totaled 4.5 billion in 2013, and it grew almost 8 to 9 folds to kind of reach 38 billion at 2018. And all these expansion actually happened prior to COVID itself, which is kind of, I suppose, one pattern that's quite different from the rest of the other countries. So the adoption really obviously accelerated because of COVID, but it was already kind of bubbling along before that. So we see that in the new investments. We also see that in the number of active users. So this charts the number of active users of internet healthcare from, kind of towards the end of 2019 to 2020. This period here corresponds to COVID. And also we see the active usership being very high, increasing during COVID as kind of we would expect. Just one final set of numbers, looking at, in this case, the volume of online consultations delivered at haotaifu.com. So this is one of the largest internet platforms providing internet healthcare. And we see this spike resulting from COVID, which decreased rather quickly over time because a lot to do with the fact that how China controlled COVID very quickly, successfully in the beginning periods. Okay, so having just, I hope I'll impress upon you the sense that the market is growing very quickly, and it's kind of playing an increasing role in the Chinese healthcare market. This is kind of where I hope to go in this talk. I'll first like to introduce, give an overview of this market, just what it is, what's the context, the policy context, the environment, the kind of services that that's provided in this market, and also very quickly how patients access care. There are a number of distinguishing factors, the points that we can differentiate between online market and physical markets. I kind of want to drive home the point, just 3 factors over here. The first factors being the role of platforms as intermediaries. I'll go into that in greater detail. The second is this Chinese healthcare market, the internet healthcare market, has a rather novel kind of offline-online dual practice setting that I think we don't really see in other countries, which again, I think it's a point that's quite unique. The third point I kind of hope to drive across is this notion of search and choice, patient choice in what is the digital healthcare market, where it can facilitate shopping, shopping for doctors, shopping for better prices, and briefly discuss the implications on the performance of healthcare systems. So I'll end this talk, given that this talk is about kind of laying a bit of ground for research. I'll kind of discuss the challenges, issues, as well as talked about areas of research that we are currently working on. Okay, so what is China's healthcare market? It's in some sense it's hard to describe a whole market. In a sense, you can describe its players, but I thought one way to kind of describe the market is describing the types of services that are delivered in this market. So you have this figure over here is really taken. These are symbols representing companies that operate in this internet healthcare space. And the kind of services that they actually provide, these are in the headings you have internet hospitals. So these are companies that predominantly work in the virtual space, but yet have a small number of beds, operate in a small number of beds, although a majority of patients that they see are in kind of the virtual setting. There's the delivering of online consultations, which will be, in some sense, in the data that I flash out, will be one of the key attributes, key aspects that I'll speak a bit more. Something that patients can do as far as make appointments via these platforms at public hospitals. So in the physical space, you have patients going physically to hospitals, taking a number and waiting. In this case, they can actually make a prior appointment at the hospitals itself. There are things relating to the apps and tools helping patients to manage their conditions, giving them health information. There are also patient management tools on the part of doctors, right? So something also that happens a lot in this virtual space is the sale of pharmaceuticals. So in terms of business to business or business to consumer type transactions. So this space really consists of a wide variety of providers, different types of companies providing services, as well as a wide variety of services. Now, let me kind of set the policy context. So the first question that you emerge obviously would be, what's the role of internet healthcare? Why was it introduced? So internet healthcare was really seen as a solution to China's weak primary healthcare system and the hospital-centric delivery system. So there is long been widespread mistrust in the quality of healthcare workers, and because of that, patients are choosing to bypass local kind of primary healthcare centers and facilities to going directly to seek treatment at hospitals, often for a disease that are very easily treated at the primary care level, and resulting in waiting times, long waiting times, as well as overcrowding. So internet care, the use of virtual consultations, provide this convenience where people could seek care, relieving the pressures of public hospital system, also kind of closing this geographical disparities in access, and it's an issue that's seen in many countries where people living in the remote and rural areas have less access to, are able to less access highly qualified medical medical practitioners. Part of what drove the growth is a combination of the government's commitment to drive this, to kind of grow this sector, right? This framework that was kind of that was introduced in 2018, where the government General Office of State Council published this framework on the internet and medical in health, wanting to explicitly develop this ecosystem and speaking on things relating to how do we think about standards of care, how do we going to use the internet health, what's its role in trying to improve resource allocation, improve efficiency, curb costs, and also introducing kind of innovative delivery methods, again, in response to the challenges that the system was and the country was facing. So there's that commitment from the government. And on top of it, internet health really also grew by, cooperation, collaborating with industries, of the like of kind of people and companies, enterprises who work in e-commerce, logistics, and communication space. An example I have over here is WeDoctor, which is one of the 4 platforms providing medical consultations as part of the WeE group. This was established back in 2010. It went through a series of fundraising, and at some point, Terence became a financial backer, right? And they took WeDoctor's healthcare platform, integrated into Tencent's WeChat, where now using the WeChat platform, users can actually search for healthcare services in addition to salon services, or coffee and all that, also using the payment system. So it is this integration between what is initially traditionally the health informatics or artificial intelligence, but focusing on health, combining with the capacity or capabilities in these other areas. And you can imagine logistics would be a huge and important partner in terms of B2B and B2C pharmaceutical sales, for instance. And then kind of more recently, there's also this effort to integrate internet health into the social health insurance system, allowing people to claim at least some for selected services, some online care through the social health insurance. So the next thing I kind of want to kind of impress upon you, at least I initially mentioned, was the rise of this platforms in the internet health market. So, and I thought this two figures side by side communicates this somewhat. One is really a virtual space where people obtain care, and the other one would be a physical hospital, physical space. And one question that we might ask ourselves is, how do we actually think about differentiating kind of traditional and online marketplaces for healthcare? So in the traditional marketplace, we talk about a hospital, we talk about clinics or cluster of clinics, a medical precinct, where you have a collection of different types of services or providers. Often, in this case, it's in a physical location and within a geographical area. And in an online healthcare market, there isn't this physical space. In fact, the space is actually virtual, and it's this platform. It's often conducted through, or I suppose, activities and conducted through platforms, and platforms play the role as intermediaries to bring together patients as well as doctors. So economists tend to call these platforms and environments as two-sided markets, where you have the role of the matchmaker played by the platforms, bringing together patients as well as doctors. There are some distinctive features of platforms that differs from traditional kind of brick and mortar type space. Scalability, for instance, if a clinic wants to increase the number of doctors it provides in a physical space, you have to think about building another office, putting tables, computers, and all that. But with the internet, you can scale both in terms of providers, and also you can appeal to a lot of buyers at a very in a low cost, where you can scale very quickly. There's also a lot of innovations relating to services, healthcare services, that are provided through this space and really facilitated through the space. For instance, the use of image, text, the use of voice and video. The platforms also provided quite a number of innovative payments and pricing mechanisms. In the non-health world, we know of things like auctions through eBay and different types of selling mechanisms through, say, Amazon and the like. There's also the customization aspects that internet platforms can provide, which I kind of won't go into a lot of detail. So again, going back to this question, how do we think about the relationship between traditional versus internet healthcare platforms? On the left here is this traditional relationship between three parties and in the interactions.
Terence, do you want to pause a bit and see if people have any question for clarification before we move on further?
Yeah, any questions? I've been super clear, so
okay.
No questions at all? But yeah, feel free to kind of chip in whenever you have.
Right. For some of those of you who signed in late, Terence did say that feel free to interrupt anytime, just raise your hand. So go ahead, Terence.
So I thought I kind of also want to kind of expand the point further about the differences between online and physical marketplaces by characterizing these relationships between actors or providers in this environment. So you have this traditional, on the left here, this traditional marketplace. You have insurance, either both played by private insurers or played by government. Okay, you have patients, you also have providers, right? So the insurers set down what the payment rules are to the providers in terms of how they choose to paid providers, such as the use of fee-for-service or capitation. The patients will would either pay the insurance premiums or taxes, according to the financing rules, and the providers would set access rules on the patients. Think about HMOs, where they kind of dictate how much care, what kind of care, and what setting you can get. Contrast that with the case of the internet care. So we have platforms providing that kind of overarching domain, and providers actually work within, patients and providers work within this virtual environment. You have the same payment rules, financing rules, access rules, right? Financing rules would be how patients actually pay platform for the services, either through fee-for-service or in some models a subscription model. You have payment rules where the platforms would pay providers, and it kind of depends on the contractual relationships between platforms and providers, whether it's a revenue sharing relationship or perhaps fixed fee provided for a fixed fee that the providers pay to platforms for the use of the platform's services. And in terms of the access rule, is it going to be fee for service, fee per use, or a subscription model where patients can just keep interacting, asking questions, obtaining as much service as they can within a certain time period. So there's this contrasting this relationship. There's also something that's quite novel in the internet health space, which is a reputation system, analogous to the kind of care quality report card system that we see in the physical world. So you have hospital report cards, both and the like, both that's adopted both in the US and UK. In the virtual space, you also would have reputation systems, rating systems, ranking systems that I suppose consumers, patients can use to assist in shopping for providers in assessing the quality. And we kind of speak to this briefly about what exactly are these things capturing towards the end. Okay, any questions? Yes, just.
Yeah, thank you, Terence. I wanted to take advantage of the spirit of conversation you asked for and seek your opinion on the rating system. And what I'm thinking of is that ratings have become so quotidian that everything from Amazon to Uber to every office is asking for an opinion. And what it has meant for most consumers is that they have a tail-heavy distribution. So they either give things like a 0 or the lowest possible rating or the maximum. And that tends to, it's one kind of signal, but it's a really blunt one. And it might not be very helpful for people seeking care. How do you think about making a rating system that might be useful in the way that you intend it?
So no, those are really important points. I suppose in this healthcare space, we'll be asking ourselves, what are ratings? What are they capturing? And do they reflect clinical quality of clinical care? Do they reflect good bedside manners, virtual bedside manners, right? That in itself, I don't think we have very good answers on. In this internet health market that we're looking at in China, the ratings play a big role. In two ways. I can kind of think of two key ways. One is some platforms actually choose to present doctors that have high ratings, right? So you think in terms of the shopping experience, the search experience, patients are already shown good quality doctors, and doctors might say, okay, because of this search mechanism, I will charge higher prices because I think patients will come to me anyway. So that's number one. Number two, also ratings form part of, I suppose, part of the measures some of these platforms use to award prizes. So in one of the platforms that I'll go into some detail, they would use ratings as well as consultations with the community of experts to determine 100 doctors that they should award best doctors of the year, right? So, and it's something that doctors can explicitly kind of hang on the virtual wall, and patients could see that, this doctor that I'm seeking care for is it's an award-winning doctor. One question they will ask is whether or not there's justification on the part of patients. Patients see that they're seeing a highly rated doctor, and they may think that the care that they obtain it's a good one, right? So no, these are important questions. I suppose similar to the spirit of the issues that you've raised in the non-health environment.
Can I add a little bit here? Jesse, you're right that a lot of the rating is really just patient experience, right? So it is not including clinical quality as assessed by any experts on these systems. Two is also many, maybe Terence would come to it, many of the doctors in China on these platforms actually are quite well-known doctors in the public hospitals. So I think it is an empirical question, interesting to look at how much is patient just choosing the name of the doctor, how much they're actually really affected by the rating as well. So, but it's an unanswered question at this point, I would say. So, Yuning and then Dan.
Hi, I have a question about the social health insurance, social insurance. Several slides ago, you mentioned there is this attempt of incorporating social insurance in the online health market. I just want to know, is that something already happened or still in the plan? And if that's something already happened, will we also have this role of government in this org chat for the online healthcare market?
As far as I understand, it's something that has happened over the last 1 or 2 years, although in a very small way. So what it was related to me is that the social health insurance reimburse internet healthcare provided through platforms owned by internet health platforms owned and operated by public hospitals. So within the healthcare landscape, there are kind of internet platforms that are private. There are also kind of internet healthcare platforms that are owned and run by public hospitals. As far as I understand, so far, social health insurance only kind of reimburse care that is offered through public internet hospitals. Does that answer your question?
Yeah, I think so. Thanks.
And
Daniel, you're mute.
I wonder if you could tell us more about how a consumer could possibly decide who to put faith in. I mean, so you have the sort of retail ratings. Now, all of us who teach here, we're familiar with ratemyprofessors.com. And if you ever looked up your Rate My Professor's webpage or that of your colleagues, it's the last thing you'd ever want to trust. It's mostly about how tough the exams were and so on. Okay, so they have that, but here we have the best of circumstances anyway. We have a lot of other things. We have fairly rigorous licensing. We have the Joint Commission on Quality Control for hospitals and systems and so on. And of course, we have the threat of a lawsuit, malpractice. So is there that kind of infrastructure in the internet health market in China? And without it, is all you have a popularity website, which is can tell you bedside manners, but maybe not a whole lot more.
To some extent, you're right. So ratings is really patient assess rating. So after the interaction, after the episode of the consultation, patients will kind of rate their provider. Later on, I'll show some kind of interesting ways in which also doctors can, sorry, patients can provide gifts. I'll come to that in 1 or 2 slides. And that in itself is also another way to show how popular these doctors are. I'll come a bit to that in a few slides there. Okay, so so the next thing I kind of want to kind of look at is this notion that, you know, the care, at least the internet healthcare space, kind of epitomizes the consumer-driven eBay transactions environment that we often see. That you can access care pretty much anytime, anywhere, and a lot of care happens through the use of apps. So this this shows how what one would look at if you use the app for this internet platform called howtaifu.com. So on the left over here, you have the user profile through the app where you kind of register, and you have a whole host of functions as well as information that you can record. In the home page, you can define a certain functions. You can look for an expert. You can get a hospital appointment. You can get medications, as well as look at recommendations on some experts and medical experts to seek care from. So there's an explicit search function. You can search by conditions. You can search by hospitals, and you know, within the subgroup conditions, you have other conditions, kind of disease level conditions that you can search by. So that's kind of one ways in which patients use to search for doctors. Once you've found a doctor that you might be interested in finding out a bit more, you can kind of click on the doctor's profile. I've kind of blacked out most identifying information like names and faces, but in these profiles you get to see, you know, what the designation is, what their appointments in public hospitals are. A lot of these doctors are public hospital doctors. What their specialty is. You also have this user feedback, which we've been talking about for quite a bit, you know, in terms of how popular this doctor is, how many people are referring these doctors to other patients, how many times this doctor has been awarded the best doctor award. You know, in this case, these doctors been awarded the best doctor award 4 times, right? And there are ratings through gifts and feedback, again, consumer rated feedback that consumers leave after this interaction. And this speaks again to Dan, what we have just kind of talked about in terms of ratings. So the patients not only can leave comments on how well the interaction went, they also can show their appreciation to the doctors by leaving different types of gifts, and these are shown in the doctor's profile, so you can actually see how many gifts doctors received, as well as what other patients have been saying about these doctors. Again, you know, whether or not this relates to quality of clinical care, we're not sure, or whether or not it's really just patient experience in terms of bedside manners. Something that we see, you know, from the point of view of the users is also the type of services that are provided, right? And the corresponding price for services. So this is where I suppose the shopping function comes in, where patients can search for, you know, understand the different types of services that are provided, how much these cost, and taking, you know, both the prices, ratings, profiles into the consideration of whether or not to obtain care from this patient, so from this doctor, or to move on to another doctor. This is some work that a figure taken from a piece of work that we recently published, describing this market, and this shows, you know, in using billing data from howtaifu.com, the different types of services that are provided on this platform. Predominantly, the service that's provided on this platform is through the image and text. That is, you know, through MMS and messaging, sending doctors a photo of a problem you have. Say, you know, I might have a mole that looks suspicious. I take a photo and communicating with the doctor back and forth in terms of reaching diagnosis, right? So that's one very popular mode in this market, at least for this platform. So it could also be in terms of voice, so voice calls which happen in the countries and in the US and many countries that we're familiar with. Also, the third most popular type of service that happens through the platform, at least this platform, is scheduling inpatient, in-person services or visits at public hospitals. In terms of how much these cost, we've kind of surveyed 4 different platforms. These are the 4 major platforms providing internet consultation. And we kind of estimate that it accounts for roughly about 60% of the market. The average price, so there's number one, there's a lot of variation across these platforms for what would be a rather standardized service that is image and text, ranging from 26 yuan to 90 yuan. So the average here is roughly about 65 yuan, which is roughly about $9 US. That's kind of how much it costs. So huge variation of prices across different types of platforms, as well as the different types of services. You see image and text, voice, average price is about 8 yuan, video is about 18 yuan. Right. What drives these differences is something that we are taking some effort to try to understand as well. But you can imagine these averages. So it really depends on seniority of doctors, location, types of specialty, and so on and so forth. So the next thing kind of want to talk about is the second aspects, which I thought was really quite unique and interesting about this healthcare space, is the role of public hospital doctors in providing internet healthcare. So I suppose the archetype provider of internet healthcare services are actually doctors that work full-time in public hospitals. So these are doctors that hold full-time employment in public hospitals, yet undertaking internet work, right? So when you go to the platform that I showed earlier on, public hospital names, doctor titles, appointments they have, these are all explicitly displayed on the platform. So it's not as if people don't know where they are. In fact, these doctors are using their titles to kind of advertise for their services. I'm a senior doctor in a big reputable hospital, and I'm providing this work, right? This is actually what we thought was a very interesting form of dual practice. The traditional sense of dual practice, I suppose we think about a person working in a public hospital and during office hours, right? Then during regular hours. Then after hours, I may operate a clinic or I may operate a pharmacy in my home. But what this internet technology actually allows doctors to do is to provide this private care within the setting of the main job, and also within the working hours of the main job. So they often, we would see doctors using their break times to provide consultations. We see doctors using lunchtime to provide consultations. It's shown over here, right? So this is, this again, it's a figure taken from the paper we wrote. It's from billing data that shows the percentage of doctors, the percentage of consultations that happen at a given point in time. So most consultations happen from 7 to roughly about 10. So if you look at bumps in kind of peaks, you have a lot of consultations being delivered after hours. So it's kind of end of the day, I'll go back, I provide some internet healthcare, so it peaks roughly about at 8 o'clock. And also consultations happening roughly about lunchtime, and differs across different types of doctors. This would probably be doctors that uses the lunchtime or morning break time, whatever time they can find within the setting of the public hospitals, which it's really quite fascinating and raises a lot of questions as to whether or not doctors are devoting their energies to working on these platforms, or whether or not they actually are devoting the care that they are supposed to do for the public hospital work. So we've just published a study, Understanding Motivations for Doctors. Why do doctors undertake internet healthcare? These are some of the key responses or key categories that I would like to highlight. Doctors mainly say they use internet healthcare to help them to be more efficient in their public hospital work. For example, using internet healthcare to prep the patients before the patients come to public hospitals by sending guides, preparing, for instance, asking patients to gather the correct information. So in this case, by setting time when these patients actually do come in to the hospitals. Some doctors also remark that they are actually using the healthcare with improved care continuity, that the hospital system doesn't allow for doctors to follow up that easily, and hence doctors are using platforms to follow up with patients after they've been discharged from hospitals. There's also control of patients. Doctors want to use internet healthcare to control the patients they want to see. They really do not want patients with common conditions to come to hospital. Not only that, it's I suppose professionally not as interesting. Doctors want to see the complicated cases, but also it's not really an efficient use of time because hospitals themselves are already overcrowded. So there's a sense that professionally doctors want to attract the complicated patients, the interesting patients to the facility, and use internet platforms as a way to kind of sift these patients through. Obviously, there's also the financial aspects. More complicated cases not only are more interesting, it's possibly also it's more lucrative from the point of view of the doctor as well from the point of view of the hospital. Doctors have also explicitly said they use platforms to build a national reputation, and this is especially true for junior doctors. So this is a quote from one of the doctors that we interviewed that I'll read. "If I was not active on my internet, my reputation would be limited to my city and would not be able to grow further. Because the internet has no boundaries, I have the opportunity to expand my popularity to the country." So there's again this sense of the world is much bigger in the internet. In the internet world, it's content a physical world that allows doctors to reach out to build a national profile. In fact, their kind of performance of platforms through ratings, through volume of patients that doctors see, could actually be potentially used as recruitment tools by hospitals to recruit the good doctors, and also used potentially as a tool for promotion and career advancement. Okay, perhaps I'll take a minute or so at this point to ask if there are any questions. Dan?
Again, it's well. I guess I have two questions at this point. One is, you didn't. I was wondering whether their participation in this is a kind of moonlighting. They can get extra income, by and whether they do this instead of doing their job during the day, or contrary, in different way of looking at it. I mean, just as almost all of us have been getting most of our care online during the pandemic, is there just a recognition that that a lot of healthcare can be provided by the internet and it's inefficient to do anything else? And so that was forced on us by the pandemic, but now, now that we see it, we like it, something like that. Okay, that's one thing. The other thing is, as they talk about wanting a national platform, they want to be known outside of their local district, but presumably discipline and quality control and so on is local. Is there, if they start drawing customers from around China or beyond even, is there any kind of national quality control mechanism that a consumer could count on, so that somebody who started drawing patients from all over wouldn't just be a good salesman, but also a good doctor.
So on your first point, I agree. I fully agree. This is like a moonlighting model, although it's not explicitly clear whether the public hospitals are disadvantaged as a result of this activity, right? Because on some dimensions, as I kind of mentioned, doctors use this to make their work more efficient, the public hospital work more efficient. And hospitals would actually like to see patients that that need to be in hospitals rather than seeing patients with common conditions. So in some sense, there's the win-win. We do not have data to yet evaluate whether doctors would kind of shirk in their primary responsibility and devote more attention to online care. I suppose the financial interests in some aspects are aligned, right? Because if you think about doctors diverting profitable patients to hospitals, and hospitals would also gain in that regard. Winnie, do you want to comment on any of this?
So there are many possibilities, but at least one possibility that we're trying to examine is that doctors actually are using these online platforms to do better triage, right? So especially these famous doctors in big tertiary hospitals, they're seeing a lot of cases that are common conditions, which is really not a good use of their time. So the platform allowed them to sort of see those patients, quickly dispel them, but they're also using this to sort of recruit and recommend the type of patient they want to draw to their hospital, the main hospital that they're working in. And this is related to how public hospitals is financed in China. Public hospitals are financed in China not by government budget, right? 90% of the hospital revenue is actually from patient service. So in a way, they are complementary. And what we understand is that those platforms that are organized and run by the public hospitals, the arrangement is slightly different because the hospital actually will allocate certain amount of time for their staff to work on their own online platform. But these doctors may also be working on a privately run online platform as well. So in a way, the quality of care on the online platform right now, it is not regulated. Right now, it's sort of a bit of a vacuum, except for the usual thing, whether you yourself, the doctor is already accredited. And that's really a vacuum. So one of our hypotheses is that these platforms definitely would have improved access and convenience. But what is it doing to quality of care? What is it doing to whether patients are actually recommended to do even more sophisticated, expensive care is a big unknown at this point.
Okay, I thought I would like to, I suppose, take the remaining 10 minutes. Firstly, to provide the sense that the internet healthcare is actually reshaping how patients make decisions at a micro level, as well as changing the market dynamics. So at the micro level, we kind of see that how internet care would actually make patients, allow patients to make different or healthcare decisions differently, is mainly through the removal of geographic distance, right? So that within internet, geographic distance is no longer a significant barrier to seeking care. So although to some extent, do we actually see that? So I pulled this set of figures that one of our partners have done in a piece of work that one of our partners have done, looking at whether or not distant effects, essentially looking at whether or not whether patients seek care from providers in the same province that they reside in. So on the right-hand side, you have physical care, showing that 95%, and in this case for the Sichuan province, 95% of Sichuan residents actually sought hospital care in hospitals in Sichuan, right? So in terms of a physical setting, people tend to seek care in the same environment, at the same location that they are residing in. Whereas in the online world, for online markets, what we see 72% of patients located in Sichuan requesting for consultations from physicians that are based in Sichuan. I suppose we asked this question, would we expect this number to be smaller? Because if geographical boundaries are no longer a barrier, you have people seeking care from all throughout the country. So you probably wouldn't see as much a concentration or home kind of bias as you would expect. But a lot of what drives the home bias is actually the fact that people use a virtual care as a first step to obtaining care in a physical environment. So part of the key reason why they are still obtaining care from virtual care from Sichuan-based providers is because they, in the end, want to end up seeking care from Sichuan hospitals. So while geographical barriers are definitely lower, I kind of don't think it's removed entirely. Because I just made a note over here in the case of Sweden. Sweden has a very interesting system where there's this online interface, online care. Patients are randomly assigned a first provider as a triage, through a triage function, and that provider can locate in any part of the country. Only after triaging that the doctor would actually kind of assign patients to a doctor that's close to where the patient's living, right? So the other thing that internet care is expected to change how consumers make decisions is through transparencies on prices, through information that's now publicly available on prices for care, quality of care vis-a-vis through ratings. And that's, in the hope that this would facilitate shopping. We know there's work done in the US and many countries that, few people actually compare costs across different types of providers before seeking or before deciding on a certain provider and seeking care. And studies have also shown that putting the price information out actually help reduce prices, also help reduce variation in prices. One open question that we kind of are starting to do some work is the question of whether or not internet markets can actually help to decrease or increase prices even, and whether that has effects on variations in prices. These two markets, virtual markets, that operate alongside the physical markets, and there could potentially be spillover effects from virtual into physical markets, also affecting choice relating to quality that providers pick, as well as healthcare costs. One key question that comes up in terms of thinking about markets would be, how do we now define a market, which traditionally have been defined based on geographical boundaries? How do we actually think about defining a market? What would be a market in non-online world? Or questions relating to whether or not whether competition exists within online markets, and whether online and offline providers compete as well. So I want to take the remaining time, I realize I've got 5 minutes left, to possibly think about some kind of challenges and issues, and hopefully end with some themes that for research. So one big question that we would ask ourselves is, what role does the internet healthcare play in China's healthcare system? So predominantly now, it's predominantly a private market that is relatively small in size, running alongside or interfacing with the public system. And I often think about public-private mix, and in my presentations and in classes in the past, I'll use this figure. So on the left over here, you have two highways, right? So you have a large public market, large public system for care, and a private market that runs alongside, which is probably well characterized by, or the Chinese internet health market is probably well characterized by this figure. You have a small private internet health market running alongside a large public hospital system. But at some point, as the role of the internet health market would grow and deepen, you have a greater interface, or in this case, the public-private meshing. You have doctors already working in both public hospitals and in healthcare. You have some financing of healthcare, private healthcare through the public system. There's social health insurance predominantly. You have private players now, but also you have public internet healthcare providers. And how would they compete? How would they collaborate? These are kind of issues that we'll be thinking about, closely when as internet healthcare, the role that internet healthcare plays in China grows. Currently, the delivery system it's highly fragmented. There's opportunities to integrate both the virtual and physical spheres of care with the aim to improve care continuity. If a patient sees a virtual provider, when would the patients be transferred to a physical hospital for treatment, and possibly integrating the experience by doing follow-ups using internet platform, for instance. There's this big question as to what is appropriate for virtual care. When do you use virtual types of care? For what types of conditions do you actually use it, and for what types of conditions these are most effective? What types of services? We saw that there's image and text, there's voice, there's video. These are still questions that not only China is kind of, I suppose, needing to ask for the context of China, but in many other developed countries as well, and in many other countries. So there's this sense that we really have to invest in data collection as well as research to understand this. There's issues relating to overuse and cost. At the moment, doctors are actually reimbursed through fee-for-service. And as we mentioned briefly, that salaries of doctors actually links to hospital profits. And then you see these incentives for overuse. And should we think about at some point moving away from fee-for-service towards payment models that especially allow the care continuity to be maximized, to facilitate the online and offline integration as well. I think I'm running kind of out of time, so I thought I would just finish with the last minute by just summarizing some kind of broad areas for research. At least these are some areas that we're starting to kind of work on. There are questions relating to the overarching market for physician service, thinking about prices, thinking about price variations, thinking about how competitions between providers affect prices, affect quality, thinking about how do whether or not care whether or not the care between the relationship between the virtual and physical interface of care, how do they relate to each other? Some work that we're also beginning to do is to understand provider behavior. How does doctors combine? How do they combine offline and online work? What are the motivations we've briefly kind of touched upon? How does these change over time in terms of when doctors change, the doctors are different stages of the careers, how do they combine these offline and online work? What are the contractual relationships that exist? How are they being paid? And how does these contractual relationships and payment modalities affect doctors' incentives and doctors' decisions concerning hours work? Also in terms of productivity, for instance. I think from the consumer side, there's a lot of interesting questions to ask. What drives patient choice? What determines the demand in terms of thinking about attributes of online and offline care. What are the key drivers? One key question is whether or not people view online offline care as substitution or complements. And the last thing, just kind of quickly, is in terms of understanding quality. We saw that with online care, there are a lot of measures being collected on ratings. What do these capture? There have been some work by our partners looking at using standardized patient approach to quantify differences in care quality between offline and online setting. But there's this broad question as to we really need to measure quality, but also the sense of what quality actually measures. I think I ran out of time, so I think I'll stop.
There's a question from Stephen.
Thank you very much. That was fascinating and raises so many problems. There are two matters that I didn't quite grasp. You mentioned the importance of online access for to reduce geographical barriers, but the map that you showed seemed to suggest that the consultations occurred only with the immediate nearby provinces or jurisdictions, whatever they were, rather than having access to physicians in other distant locations. And the second question I have has to do with the importance of hospital profits. I think you alluded at one point to the fact that physicians' income is linked to hospital profits, which would seem to suggest that there's an advantage not to have online service, because the more people come into the hospitals, the more they are charged, the more profits there are, and the higher the salary of the physicians. Did I misunderstand that? And again, thank you very much for a fascinating presentation.
Thanks for the question.
Do you want me to answer the first one,
Sure.
the geographic location one, since I work on that? So I think, Steve, what Terence was saying is that the online market break the geographic barrier, but if you look at empirical data, people still tend to on the online platform, even though they can see anyone who's on that entire platform nationally. The patients themselves, empirically, we find the patient themselves still choose to find a doctor who is in their location, and it varies by specialty. So patients who are seeking care, which is from specialty, who might likely need a follow-up that is offline, then they tend to still make an appointment with the doctors who is within their geographic area. For conditions, let's say skin condition, quite often doesn't require an offline follow-up visit, then the patient tend to choose a patient on a platform that might go beyond where they live. So there's that variation. Terence, you want to take the second question on the physician profit?
Yeah, so the way physicians are paid is a function of hospital profits, so through bonuses. And I think there are two channels in which I suppose one key channel is that physicians can actually use internet healthcare to divert the profitable patients, as what Winnie mentioned, through a triaging system, not only to triage the common cases and kind of easy to treat patients cases out, but also to triage the lucrative patients into the hospital. And it's in some sense a win-win, because their financial incentives do align. Physicians actually gain from having that patient in, gain the share of the revenue from the internet healthcare consultation, initial consultation, treatment, and follow-up. And the hospitals also do gain through that revenue. So there's this bit of competition for patients, and using that as a means to compete for patients. So I suppose in terms of revenue space, it's not just having that additional means of revenue by providing internet healthcare, but using that to enhance the revenue of hospital itself. So it's kind of a two-layer system, two-layer incentive.
Right. I'll also add that, Steve, for in China, most of the tertiary hospitals are actually at full capacity. So what they're interested is actually not getting more patients in terms of numbers. They want to be able to get the patients that they think would enhance two things. One is, as from the interview that the doctor said, they're actually interested in getting more complicated patients, right? Because from a learning perspective, it's more challenging. They're also more interested in getting complicated patients. Also from a financial perspective, it is more likely they can do more diagnostic tests and more advanced services. So, so it's more a substitution, but I could imagine that, let's say a secondary hospital that is not at full capacity would view this differently. So all these are still unknown, and that's what we're trying to unpack. Yeah. We have past time, and I'm sure for those who want to stay and talk to Terence a bit more on another question, I'm sure Terence is willing to, but for those who need to go to another meeting, feel free to do that as well. So I just want to thank Terence for giving this presentation. I find the internet market in China fascinating. I think there are a lot of relevance for other countries, especially like India and even the US. And so we hope that as you or us progress with the research and learning, we will continue to share and learn from each other. Thank you.